Do hair transplants leave scars? Well, it depends on what technique is used. Big differences between the FUT and the FUE we covered earlier in one of the earlier videos. However, let's remember the FUT requires an incision in the back of the scalp and with closure with stitches. Naturally, that's going to leave a scar. All incisions leave scars no matter where they are. We try to minimize that scar by doing good closure. But out of the two, the FUT is going to leave the more prominent scar. The FUE, because that real tiny little biopsy punch that's anywhere from 0.8 to 1.2 millimeters, by definition, is not an incision. It's almost a puncture wound, if you will. So there's no scarring in the sense of making an incision and having a scar. It leaves a tiny little scar in the scalp, which is not visible. Think of each of those little punches that we talked about with that diameter, less than 1 millimeter. It's akin to almost little pimples that you might feel during the healing process. Once the healing process is done, you don't feel anything at all in the scalp. It feels natural like it did before any transplantation. So what are the factors that can minimize scarring after a hair transplant? Number one is the technique used. As we mentioned in an earlier video, the FUT procedure leaves a scar, although it can be minimized by meticulous closure and by the patient taking care of the incision afterwards. What does that mean? It means not getting the incision dirty, using the proper shampooing techniques, avoiding strenuous exercise that could cause bleeding, and that would clearly increase the scarification due to opening up the incision, for example. There are certain ethnic groups that will tend to scar more. The African American population could have a higher tendency toward keloid formation or hypertrophic scars. So that's something we don't have control over because we can't control the ethnicity. It also does not mean, however, that if you have darker skin, a person of color, that you're automatically going to develop a larger scar. That's where the history taking is important. We'll ask the patient if they had previous surgery. We'll look and see if they had previous surgery. Did those incisions heal nicely with a keloid or a hypertrophic scar or not? Again, comparing that to the FUE, across the board, an FUE or the microfollicular transplantation will always scar less because no incision is made.
Is there any preoperative care to minimize the scar after the surgery? The first, the hygiene of patients, especially the scalp, is very, very important because you don't want to have any infection going on after the surgery. You want to make sure that everything is clean for the surgery. Also, to prevent any infection, putting the patient on antibiotic preventive is also important to minimize any scars that might happen during the surgery.
So I would add to what Dr. Nam said, avoiding sunshine to the donor site area. Scars are always going to be made worse after someone is in the bright sunlight after scarring. Whenever we do facial surgery, we tell patients to stay out of sun at least a couple of weeks, and then if they go into the sun, they're using SPF, not to mention the severe sunburn they would get to the area with pain. So another big factor is avoiding direct exposure to sunshine for several weeks after the graft.
Can you remove a scar from hair transplantation? After FUT transplant, when you get a long linear scar, it is possible to remove the scars that's created on your donor side. If you are having another second FUT, we can make the incision along the same scar that you had from your previous surgery to minimize any scars. Also, another option is that we can actually implant hairs onto the scars to cover the scar and have new hair growth to cover the scars from previous any surgeries.
You could also inject the scar with steroid, which minimizes scars anywhere, and that's another technique that we can use in those cases where scarring is prevalent. I have to say, though, that scarring to the degree that would be bothersome to the patient is infrequent.